Hi, my name is Dr. Scott Santamore.
And I'm Dr. George Rogu, and we're both from RBK Pediatrics and Urgent Care.
And we just made this video for you today in anticipation of your visit to RBK with your 2.5-year-old. We just want to kind of let you know what to expect when you come in, things we're going to talk about, and stuff like that.
And we'd also like to share some of our experiences from what we see in the exam room.
So when you come on in, we're going to catch up since our last visit. This is the longest it's been since the last time we've seen you. It's been 6 whole months. So there's going to be a lot to talk about in terms of development. Most importantly, though, we talk about growth. We always look at those growth curves. By far the most important part of the visit, making sure the kiddos are growing and gaining weight properly. We review the developmental milestones. We do a nice full physical examination, and then we talk about vaccines. We talk about anticipatory guidance for the 2.5-year-olds. Dr. Rogu, what kind of things do you like to talk about at this age?
Well, I'm big on safety because 2.5-year-olds, they're very rambunctious. They jump, they climb, they fall, they jump in the water. Unfortunately, sometimes they also drown. So that's my big one.
Yeah, the water safety is very important. I was a lifeguard my whole life too, and a swimmer. So I'm very big on the water safety. Always make sure the kiddos are supervised. They're never swimming alone. They always have a buddy.
Right. Nutrition is also very important because the 2.5-year-olds, they tend to like to eat whatever's on the children's menu at the restaurants. Usually pastas, breads, chicken nuggets, burgers. You should try to get them to eat some fruits and vegetables, especially the boys. The boys they don't like eating fruits and vegetables. Try to get them to eat it earlier. Try to get them to use, forks and a spoon. Get them to use utensils, drink out of a cup. And definitely you should limit the sugary drinks. If you go to to a park or something, people tend to bring, juicy juice or different Gatorades. Bottled water is more than adequate for these children.
There's so much sugar in those juices and the Gatorades and stuff like that. The kids can't possibly burn off that many sugar calories.
Correct.
The other thing we like to talk about this age is getting a good sleep routine together for the kiddos. This is one of those things that if you get a good habit together now, the kiddos will never have problems with sleep growing up. At this age, we like to get the kids between 11 and 14 hours of sleep per night. It helps to try and get a consistent bedtime routine together. Kids are very routine oriented and very structure oriented, and they like things the same way, the same time every day. It's important to make sure they feel safe and they feel comfortable in the dark as well.
Yeah. And you will have curtain calls where you'll put them in bed and then they'll come back out of bed and they'll visit you again. They'll keep doing that. Just keep putting them into bed and let them sleep. Do not bring them into your bed because then you're going to ask Dr. Scott, he's sleeping in my bed. He's too big. How do I get him out of the bed?
The longer it takes to get him out of your bed, the harder it is to do too.
Yep.
Also at this age, the kiddos' language is starting to explode. They're starting to talk more and more and more. We have to encourage that kind of developing, talking a lot to them. Have conversations with the 2.5-year-old. It seems silly, but all of that practice really does help them form the words and the sentences a lot better. Read books to them, sing to them, encourage them to play with their friends, their brothers, their sisters, and guide them together. In a very positive kind of way. Kids need positivity and encouragement to want to continue to do things, to want to try speaking more, to try to form those words. So be very positive and encouraging.
I'm also noticing in the exam room, lots of young children with a phone. They're playing the YouTube Kids. They're just becoming like hooked on that phone at 2 years of age. And it's pretty disturbing because, I recall seeing a patient where the mother was talking to me about another child and the child was on the phone and it was making a lot of noise. And I asked the mother to stop, took the phone away from the child. The child had a complete meltdown. So do not let these children get hooked on the phone, the videos and all that kind of stuff. I know they're good at it, but they should engage and talk to people.
It forms very bad habits.
Yes.
Speaking of good habits, we start to talk about dental health at this age. What kind of advice do you like to give the parents for that?
Well, at this age, we're already giving them multivitamins with the fluoride. The children should be brushing their teeth a little bit. You have the children's toothpaste that have, smaller amounts of fluoride. They should avoid the sugary drinks. and definitely they should already be off the bottle, but the children that tend to sleep with the bottle tend to have a lot of tooth decay. So this is if the child had already been sleeping with the bottle by this age, you already have severe tooth decay, and they should visit the dentist also.
Yeah, around this age is the first time we like to recommend them going over. And at this age, it's not for any actual sort of dental care. It's more for the practice, the expectations and stuff like that.
Correct.
Safety.
Yeah,
the kiddos are now moving around on their own. They're getting into everything. They stick everything in their mouths, and they don't know what's safe and what's not.
correct.
Childproofing the home is very important.
Yeah, I've seen every single picture in a real life patient. Children opening the cabinets and drinking Clorox. Children taking the scissors that are pointy and stabbing themselves. Going inside the washing machine, I've seen. Unfortunately, too many children mistakenly take medications from the grandparents or the parents. The TV and the child holding onto the dresser. They pull down, their weight pulls the TV down. Fortunately, the TVs are not so heavy anymore, but when there used to be those big tube TVs, let me tell you, that thing came down and would crush a child. And then water scald burns, plenty of them.
Yeah, a lot of this comes down to prevention and how we organize our houses and making sure we keep all of that stuff up, high, away, locked away, and stuff like that. Prevention is the best cure for anything. And just making sure we stay organized ahead of time. We don't have to make following the kids around the house a full-time job.
Yeah, I learned that child safety is not really, childproofing your house is not really childproofing your house. It's really delaying a child's activities. So if it's too quiet for a 2-year-old and nothing's happening around you, I can almost guarantee that that child is up to something if it's too quiet.
Huh. So speaking of the language, we spoke a little bit about that before. Some of the best ways to try and encourage the kiddos to speak. I mentioned the positivity, speaking with them, singing songs, making things fun for them so that they want to continue to do it. The motivation for this stuff has to come from the kids themselves. You can't make the kiddos do anything. So making things fun, interactive, bright colors, noises, songs, that's what gets the kids excited for this kind of stuff. What other advice do you have for parents in trying to encourage the words and the speaking?
I think the simplest thing to do is to read and just speak with the children.
Yeah.
Have them engage in the conversation if it's at all possible, and stay away from the tablet. Don't use the tablet to engage language. I mean, you could use it together, but don't hand it to their child to just use it by itself.
Yeah, there is no substitute for actual practice.
Correct.
So screen time, the big topic, we've already spoken about it with everything else, and this does bleed into everything else. The American Academy of Pediatrics recommends no more than 2 hours per day of screen time, but that 2 hours they recommend is educational, interactive. What we don't want parents doing is just giving the kiddos the phone, just giving them the tablet and having them sit there and occupy themselves. We want the screen time to be interactive with mommy, with daddy, with the brothers and the sisters, singing the songs, practicing the words, pointing out the colors, looking at objects. That's the good stuff for the kids, and that helps their brain develop. Just handing them the tablet and having them just keep themselves occupied, it doesn't do anything beneficial for the kiddos. Potty training. This is the big one. What is your advice for potty training?
The children will, when they're ready, they'll let you know. But if they're starting to be very, very old, you probably missed the boat a while ago. When the child seems to be ready, I would just put the child on a potty, let him engage, let him interact with it. And then when he can go, he can go.
Yeah, I mean, my advice comes down to making the kiddos feel comfortable with it. And so you put that little potty somewhere in the house that they're comfortable, and you sit them on it a couple times a day, sit with them, bring a book, sing songs, make it a kind of fun, comfortable experience. If they do actually pee or poop in the little potty, make a huge fuss, make them feel really good about it. And if they don't, after 10, 15 minutes, let them go, have fun, play, but don't make a big deal out of it. We want them to feel comfortable and encouraged for doing it.
Probably screen time would help this.
Yeah.
If you put them on the phone and put them on the potty, they'll probably sit.
Right? Give them something else to think about.
Yeah.
So vaccines. At 2.5 years old, the kiddos are already asking about shots when they come into the office. At 2.5 years old, thankfully, we do not have any scheduled vaccines for the kiddos, and we do not have any scheduled lab work for the kiddos like we did when they were younger, pricking their finger for the iron and the lead. If the kiddos are not fully caught up on their vaccines, they might be due for some vaccines at that visit there. During the winter months, we do recommend the flu vaccine every year for the kiddos. Our studies have shown us that every year we get the flu vaccine, it not only makes the past flu vaccines that we've gotten more effective, but it will make future vaccines that we have not gotten yet more effective as well. We do highly recommend the flu vaccine during the winter season. Lab work at this age is just if we're looking for something specific. Some schools require the PPD for tuberculosis under the skin there, but generally speaking, the 2.5-year-old visit is a little bit easier on this stuff for the kiddos. So that's our video for the 2.5-year-olds. We're looking forward to seeing you guys in our office. Any questions you have, we'll be happy to help you with. Anything you need, we'll be happy to help you with. Give us a call. Again, I'm Dr. Scott Sinamore.
And I'm Dr. George Rogu from RBK Pediatrics and Urgent Care.
Thank you.